Welcome back to The Cinnamon Effect. I'm Kimberly Hand, and today I have Dr. Kunal Gandhi, who is a functional medicine practitioner. Through her extensive training in primary care and functional medicine, she has fueled a deep passion for an integrative, holistic, and preventative approach. By merging traditional and holistic medicine, she guides her patients to take control of their health, reverse chronic conditions, and activate self-healing at a cellular level. Her approach examines you as a whole, considering genetics, lifestyle, environmental, and mental well-being, avoiding the isolation of symptoms. And this is part 2 of our episode. We're actually diving a little deeper. So if you didn't catch the first episode, go back with Dr. Gandhi, go back to last week's episode. Yeah. Listen to that one first, because if you're new to functional medicine, you're going to want to listen to that because we really touch on a lot of good topics. This episode is we're going to go a little deeper into other things like autoimmune, parasites, hormones, all kinds of stuff. So listen to the first one and then come back and listen to this one. So Dr. Gandhi, thanks for being here.
Of course. Thanks for having me.
What is the most common thing that you are seeing in your practice right now?
I would say one of the top things I'm seeing oftentimes is autoimmune or just chronic inflammation.
So autoimmune is something that I'm familiar with now, but you gave some statistics in the last episode as far as like how many people are actually suffering from different types of autoimmune.
Yeah, it is a huge amount. So about 80 to 100 million people have autoimmune disorders, whether they know it or not, which is more than heart disease, cancer, diabetes combined. So it is definitely something that needs to be talked about more. Mm-hmm. And it is part of every specialty in medicine. It's just that they're just seeing their little bits and not really seeing that, wow, like every specialty has this. So I think that that's like one of the biggest topics that I'm seeing constantly in my practice.
What are some of the most commonly diagnosed autoimmune?
I see a lot of arthritis.
Okay.
A lot of Hashimoto's, a lot of celiac. Psoriasis is another big one. Lupus is another big one. You know, they all kind of branch from the same source. They're all your body's immune system overreacting, attacking healthy cells. It's just that every patient is getting attacked differently. Even allergies, asthma, that's autoimmune.
Wow.
You know, your body's overreacting to the environment and causing you to react to pollen and grass when your body really shouldn't. So it's really about, you know, not treating it so much as like autoimmune, but what in that individual patient is triggering their autoimmune, whether it's foods that they're eating, whether it's the environment that they're living in, whether it's heavy metals or pesticides, you know, all those things contribute to autoimmune disease, and really finding out what each patient has to attack it. And then their autoimmune markers, their numbers, things get better. I think diet plays a big role.
Wow. So I was today years old when I realized, that you just told me that asthma is autoimmune. Like, I feel like a lot of people don't know that. Yeah. Psoriasis, that I never would have considered that as an autoimmune condition.
Right? Because your body's attacking the skin. Yeah. Your body's like overreacting to the environment and causing your lungs to overproduce mucus because it's like constantly fighting, right? It's an inflammation process. So, and you know, I can go outside and I'm fine with pollen and I'm not like overproducing mucus, but somebody else who has some kind of like asthma issue, they can overproduce that mucus and cause like almost an asthma attack, or the spasms of their lungs, which make them require to have medications and things to stop that so they can go outside and go running.
Wow. So if you see someone who has asthma, I mean, I feel like typically they're just prescribed an inhaler, right? And like sent on their way, kind of. So how would you address somebody that's presenting with that?
Typically they'll get like an albuterol inhaler and then they'll get steroids, right? Steroids suppress the immune system. Whereas I'm going to modulate their immune system. I'm going to tell their immune system, stop attacking this. Let's go attack the bad guys. Instead, those patients with asthma, number one, foremost, get rid of the dairy. Dairy is not your friend. It causes so much mucus production. So across the board, those patients are going to get rid of dairy. A lot of those patients are younger patients. So it is a little bit more of a challenge with those younger patients, especially when we're talking about dairy, gluten, sugar, all those things are making their asthma worse. So we try our best in that patient population. And then I help with their histamines, right? Because there's a lot of histamine issues with those patients too. Okay. So we talk about the foods high in histamine. Avocados are so healthy, but they have a lot of histamine issues for my patients.
So explain what a histamine is.
Histamine is released by your allergy cells, and they basically cause you to have that itchy nose, runny eyes, just kind of feeling more inflamed.
Oh, interesting.
And so like quercetin is a great supplement that you could take to help with that kind of symptom. So, we'll talk about with those patients, like what things can we do on a day-to-day basis to cause to lessen that immune response to the environment, and things you can do. You can't get rid of all the pollen in trees, but you can change around your diet or your lifestyle and what you're putting in your body.
Yeah. That's what I think I really love about functional medicine. It being a patient is like, I feel like where you could feel overwhelmed by it, look at the positive and think you actually have so much control over how you feel, right? Yeah. Because you're the one that has to like actively make these changes to your lifestyle.
I think a lot of patients who come to me, they know. They already know.
They already know.
They already know. They're so smart. I learn so much from my patients every day, but they know that, soda is not good for you. And they know drinking 2 glasses of wine every night is not good for you. And sometimes they just need that reminder. And I find that a lot of patients, they'll come to me and they'll tell, I have like all these fitness people, all these athletes, these people, they know what is good and bad for their body, but sometimes you have to see the numbers. Sometimes you need a little reminder. I need it too every now and again. I need somebody to come remind me like, hey, you don't have to work 24 hours a day, so we all need that little reminder. And I feel like I get to be that source for my patients that know, they already know, these foods are inflammatory. When I eat them, I don't feel good. And if they don't know after the first month of seeing me, they know.
Yeah. They're like, oh, okay.
Yeah.
So because I have Hashimoto's, I want to kind of talk about like how you're evaluating those numbers. Cause I'll be honest, the numbers still confuse me.
Yeah.
Like what I'm looking at antibodies versus this versus that. Like, Can you talk about that a little bit?
Absolutely. So the TSH is a thyroid stimulating hormone, and that is a communication from your brain telling your thyroid to work. Somebody, when that number is above 2, your brain is like screaming at your thyroid to make hormone. Okay. Now you can have a high number, but your actual thyroid function could look pretty good. A lot of your Hashimoto's patients, you're going to see the TSH being higher than 2 and then their function being good. It's because the brain now doesn't feel the thyroid working. The thyroid's like, I'm doing my job. But the brain's like, hello, wake up. It's because there's so much inflammation around the thyroid that the brain really can't feel it. So that's probably the most important or first number that traditional, conventional doctors look at, and functional medicine for sure. We get that number. I would probably say the most important number is your free T3. That is your active form of your thyroid. And I typically want my patients to be around 3.3. And this is like going with Quest Labs, let's say around 3.3. That would be like perfect thyroid function right there. Like that number looks great to me. So again, you can have Hashimoto's, that free T3 can be perfect. And, we have to work more on decreasing the inflammation in your body, removing the toxins and getting your thyroid and your brain to say like, okay, we're both on the same team now. Now over time, so like when you're first diagnosed in, let's say that conventional setting, they're going to say, okay, you have Hashimoto's, but your thyroid function looks fine. Don't worry about it. Whereas in functional medicine, we're like, okay, let's worry about this, because if we don't take care of it, you're going to end up on thyroid medication, because there's going to be a point that your thyroid's going to get tired and it's not going to be able to function. And then we're going to have to rely on pharmaceuticals way down the road. So that's when I really like to catch those patients is like, okay, we're not quite there yet, but we can do all these things. I love peptide therapy on a lot of my autoimmune patients, because that can really signal your immune system to like do better kind of thing. So I use a lot of that. We can decrease the inflammation. A lot of my Hashimoto's patients don't end up on medications, thankfully. I do have a handful that, we have to go down that route, and that's okay. It doesn't mean it's forever. There's so many patients that we've gotten off of their thyroid medication.
Oh, wow.
Because we're healing, repairing, recovering the thyroid, that like things can work again.
So that's encouraging. Like if you're on, it doesn't have to be that, you never went on vacation. I wish we were talking about vacation. Yes. But it's not like you went on medication and then you can never reverse that. Right. So you're saying most of this,
if you catch it early and you do something about it, absolutely, you don't have to go on medication. Now, of course, I've had patients who have been on like thyroid medications for years. And actually, I'm thinking of somebody off the top of my head right now. She's been on thyroid medications for years and years. And then every time we're checking her labs, it's like, oh, your thyroid looks a little hyper. Let's like decrease the meds to the point that we got her off the meds.
Wow.
And then we just had her on the supplements. And then again, we do her labs. And again, she was still showing a little bit hyper because those medications, they have glandulars in them, and they can actually help rebuild, repair, heal. And they work as strong as some of the medications. So then we have her on the supplements and slowly got her off of that. And then before you know it, her thyroid function is just functioning great. She's a patient that loves the IVs, does a lot of peptides, she works out a lot, she eats really clean. So she really took her health into her own hands and really helped her body out.
Wow. Like that's so amazing. I feel like I'm on that road too. Like I'm trying to do all that. It's encouraging to hear somebody else that has a success with it. And it is, like I said, you're having to kind of take your health into, control, get control of it. Right. But stay committed to it as well.
I think the other part of the thyroid levels that you had mentioned, you wanted to dive a little bit deeper into that, is checking your iodine. Right?
Okay.
Iodine is really important for thyroid function. Now, some people with autoimmune don't do well with high doses of iodine or even any iodine. Sometimes we'll do just small doses of iodine just to kind of help your thyroid function better. Thyroid issues has been more and more prevalent since we've gotten rid of a lot of that table salt that has iodine in it, right? So I'm not saying that table salt is great and start eating a bunch of it or anything like that, but it was in our diet at one point, and now we've gotten rid of it. So again, you see that a lot of physicians out there are not checking the iodine level, which it could literally be just a couple of drops of iodine that you take a day and your thyroid functions much better.
Oh, wow.
And you need iodine for your thyroid to function. And then, a lot of people are eating bread that has bromide that kind of fools your thyroid into thinking that it's iodine, but it's really bromide, can really throw off your thyroid function too.
Oh, interesting. Yeah. I mean, what's wrong with that it is mimicking something else? So is that can you get iodine from Celtic sea salt? I know that's kind of like a craze. I feel like people are doing.
Yes, yeah. I like it when patients put that in their water and get some minerals. You can get a little bit there. You can get some from seaweed. Those are great sources of getting some iodine.
Yeah. How much salt are we talking in
just a pinch?
Just a pinch. Yeah. Okay.
Okay. No, we're not.
I got to tell my husband
covering our fries.
Well, he's actually adding it to, water, but I think he's doing kind of a big scoop of it. So I don't know. I have to address that with him, but
yeah, you probably don't need that much.
But yeah, I kind of like to add that to my smoothie occasionally, even if it's chocolate, you put a little salty, thing in it. It's pretty good.
It's the thing, the sweet and salty desserts.
Yes. Yes. And what about those, electrolytes, element electrolytes? Have you seen those? They have, I'm not sure. They have salt in them, but I don't know.
I've seen so many different ones. I can't remember the label of that one off the top of my head. What I would just recommend is so important for my patients to read the label. Yeah. If the first ingredient is cane sugar, that's more of a dessert than helping your health. Yeah. Right. So I don't know that label off the top of my head, but if you're seeing that it's not a lot of sugar and gums and additives, it's fine, and you want to make sure that the source is good too.
I know that the symptoms obviously can vary for autoimmune, but if someone is experiencing, you tell us, certain symptoms, that would be kind of a red flag to say, maybe you need to see a functional medicine practitioner and be tested for an autoimmune condition. Yeah.
I mean, I test all my patients across the board because I know if I catch it early, I can do something about it, and we can kind of stop how aggressive it gets. And I would hope that it doesn't get to the point that patients are symptomatic, that we're oh, okay, now we need to do something about it. I would hope that even, their conventional physician would go ahead and order that lab. It's so easy to order on them, and insurance typically pays for it. So it should just be ordered if it's brought up during that conversation. But yeah, I think that it's worthwhile, even if you think you feel good, right? Because I have so many patients that are yeah, I feel great. And then I get their labs back and they didn't know how good they could feel. They were just like, well, I'm 50 years old and I think I'm doing pretty good. And then I'm like, okay. And we get their labs back, kind of detox them, clean them up. And they're like, oh my gosh, like I feel like amazing.
Wow.
And it's like the next level of health. It really is about like reversing your age and longevity and feeling good. Modern medicine, we can keep you alive forever.
Yeah, right.
But like, how well do you want to live? Do you want to just be bedbound and feeling terrible? Or you want to be able to be up and walking and have your memory and, be able to function and be independent is really the goal. Yeah.
So maybe we can talk a little bit about emotions and trauma and how you're, like, I know with me, you addressed that with me right off the bat. Like that was something that you brought up. And I did not even consider that could be maybe causing some of my symptoms. So how do you kind of address that with your patients?
Yeah. So a lot of patients are very nervous. Their first time they're coming to a functional medicine doctor and they don't know what to expect. And, I think it's so important to be open and welcome and non-judgmental and just have a safe space for the patient. I think is like first and foremost that anything goes here. There is no judgment and, starting there and allowing the patient to express themselves. I think that's why I love that I have hour and a half appointments with my patients because they don't feel rushed. They can tell me their life story. They can tell me what happened in childhood that they're still holding on to this day. And that kind of patient is really important for us to discuss medicine and discuss your gut health and all those things, but not make that the priority. Right now, the priority is that, hey, you're here today and you picked yourself and I'm so proud of you. Yeah. And just saying like, you already won, like you already won. And when they feel that sense of like excitement, like, wow, like I did do that. Like I'm so scared to come today, but I'm here. That's really, really exciting for the patient. And then then the patient and, they're more open to like, what, I'm so excited. I already won. I already achieved something. And now I'm going to take these supplements. I'm just going to try it out. Yeah. And those supplements are going to provide them with a little bit of energy. They're going to help their body make some serotonin. And probably at that point, you got some supplements in there. I'm going to discuss the food stuff, but I'm not going to drill it in their head as hard. I'm just going to say, try these supplements. And I want you to walk outside for 15, 20 minutes a day. Do some like no shoes, don't wear your sunglasses, and let's just try that out. And I'm going to touch base with you in a couple of weeks and see how you're doing. And in those couple of weeks, you're like, Dr. Gandhi, I did it and I started out really strong and it fell off. That's okay. That's okay. Like, how did you feel in those couple of weeks? I felt great. Okay, let's try it out again, and just kind of baby steps with those patients. And it's really about getting to a point mentally that you want to work on your health, because when you're feeling that low, you don't care. Yeah. You don't care about your health. You don't care that you didn't get up today. You didn't care that you didn't shower. So just those baby steps and taking those little wins is so important. I talk about EMDR a lot with my patients. I personally had went through EMDR, super skeptical about it in the beginning. I was, just out of primary care, and I had, like everybody had stuff that happened to me, and I was just holding on to it. And the orthopedic that I went to, because I had injured my shoulder at the time, he actually was like, you need to go do some EMDR. And I'm like, what's that?
Can you tell people what that stands for?
It's like,
it's eye movement, something.
Rapid desensitization. I don't know. I don't know. I can't remember.
Okay, we got to Google it.
It's like, but it was crazy because when I did it, I didn't even do like the eye movement one. I did like I had like these like vibrating paddles in my hands. But he was the one who's like, hey, I think you should go to see this lady. And I was like, okay, and I was super like not into it. Yeah. And I just kind of sat there, and she was like, what you're doing isn't working. Let's try something new. And I want you to be open to it. I was like, okay, let's do this. And I would say like I was, I had the time at the time to do a bunch of sessions, and I did like 2 a week. And by the 8th one, I was like, why am I here again? Like, I feel fine. And in the beginning, I was like all tears, so emotional. It was like, just just a switch turned on. And I just got to the point now, which I think is such a blessing looking back, is that I can talk to my patients about it. Like, hey, you know what? Like, I've had stuff happen to me too.
Yes.
And I've been through some hard times too. And I'm not in tears. I'm not like, a mess kind of thing. So I think that's really important that, people can feel like, stuff's happened to her too. It's not, her life ain't perfect, kind of thing. It's kind of nice when you get to open up and just relate to people.
Yeah.
So I love EMDR. I know there's so many different kinds of treatments out there for trauma. We even vagus nerve stimulation is a really big one. A lot of my patients use meditation in their practice to get their, anxiety and stress down. So many great things out there.
So many great things. The EMDR really had, you had suggested that to me as well, because I had already been diagnosed with PTSD, but I didn't feel like I had really tackled it. I was still, when I would tell the story, I was still very emotional. I think, like I said, I cried like the whole hour.
I cried with you.
I know you cried with me. And you said, you actually explain it perfectly just now, because I had the same experience. I did the paddles as well. And I had also done the eye movement with there's lights and things. And I had done that first. And then I did the one with the paddles. So I had 2 rounds of it, but I experienced the same thing where all of a sudden it was one session. I just went in there and I was like, I feel like I'm okay. I feel and it's doing something between the eye, the hands, the brain. It's all working together. And I did feel a relief from, I think you never forget the traumatic event, or maybe it's a series of traumatic events, but it really does help tackle that brain association, I guess, because you're visualizing and you're doing, different things as these paddles are going off, and it's activating different parts of the brain. Right. Yeah. So it's it's pretty magical. If you are out there dealing with trauma, I think that was such an important thing that nobody else had mentioned to me. Maybe you should.
It's always do this. You really have to feel out the patient, because I think a lot of my patients probably, that traditional route of medicine told them mentally there's something wrong with them, right?
Yeah.
Those patients who are I, have numbness and tingling and everything's coming back fine. And, it's really about the right patient and having that connection with that patient and saying hey, I hear you when you say that you have numbness and tingling, but do you think that maybe there's this other component that could be contributing? There was a patient that this famous therapist had told me about chronic tooth pain, really bad tooth pain.
Oh.
And, went to the biological dentist, went to the regular dentist, got the tooth pulled, everything you could possibly think of, but severe pain, keeping the patient up at night. And they went through EMDR, and as they're going through that, they didn't even know what their trauma was. And it was they had been kidnapped when they're younger or something. And
wow.
It was when they went through EMDR, they released that pain.
Wow.
And it wasn't the tooth need to be pulled and all that stuff. It was really that's where they were holding it. I had another patient recently who was holding it in her throat. And so she actually went through energy therapy with another good friend of mine. And, that's still something I'm learning about, but went through energy therapy. And as she's going through the therapy, she's coughing a lot. And they were saying that her trauma is in her throat.
Lodged in her throat.
And it's it's still over my head. I'm still learning and understanding, but it's hey, if it works, it works.
Yeah.
And you have to pick the right person to be ready to have that conversation, and not everybody will have that conversation on day one.
Yeah.
Sometimes
that makes sense.
It happens couple appointments in.
But that makes you such an amazing practitioner to even consider those things, because I think those are just as powerful, right? Sometimes as the supplements and the diet changes and everything else, it's addressing these other things in your body. It's all really energy.
It is really treating the whole body. You don't leave any part of it out, and treating the house and treating the family.
Yes.
It becomes a whole army.
Yeah. So I think, I just hope that people get a lot from this and think that there's other ways. If you're not getting the answers that you seek, out there with the doctor that you're seeing, there are other ways, and there's other things that, yourself would evaluate, to get some answers. But I also want to talk about hormones.
Yay.
Yay. And how how you like, let's get deep in here, because how are you testing for these hormones? What kind of panels are you doing? And then, with people with hormone imbalances, how are you addressing that with your patients?
Yeah, that's great. So testing, typically I start out with blood testing. That is not the best way to check hormones. It gets covered through insurance and we start there. If somebody, that's not their main concern, I'll probably just get the blood work. And, based off of that, those patients who that is it, like their hormones are really out of whack. We've tried treatment. We've tried different things. I do the Dutch test, and that's a urine test.
Okay.
That would do. And that is very accurate. And it gives us because it gives us the byproducts of the different hormones, whereas like blood testing, you can check the progesterone, but you can't check like all the precursors of the progesterone necessarily, or testosterone, but all the precursors of it. So it helps us figure out where in the pathway is this patient's hormones going wrong. Okay. So those are kind of the two main ways that I test my patient's hormones. Treatment for hormones, again, it's all over. So let's say I have a young menstruating female, terrible periods, severe, endometriosis, whatever the case may be, that kind of patient. When we get our labs back, we would talk about like topical progesterone, like a bioidentical. And that means that it's the same format or same structure as what your body's already making. And you can see it get better in the labs or the urine test, right? Whereas like synthetic fake hormones that you were thinking like birth control, right? And you can't really measure that in labs, and kind of makes your body go down the bad pathway. So those patients, usually like a topical progesterone is where I would start with those younger menstruating females, trying to control their cycles and trying to regulate their cycles and help with cramps, even moods. Progesterone's awesome for that. Progesterone is probably the reason why I got into functional medicine, because I've always struggled with my cycles my whole life. Yeah. And it was right out of residency. And I'm like, birth control cannot be the only thing. Like I feel terrible on birth control. And like everything kind of went out of whack when I was on birth control, but my periods felt a little bit better, but the side effects weren't worth it. And and my very first conference I went to for functional medicine was endocrinology. With one of my really good friends. She's like, come with me. I'm like, okay. And I learned about topical progesterone, tried it out, changed my life. And I was like, okay, there's more to this. Like this makes sense. And that's what got me into functional medicine was that right there. And so, your polycystic ovarian patients, they're going to kind of hold that midsection weight. That's insulin resistance. They're going to have a little bit of more like peach fuzz on their body. They're going to kind of get really bloated. They're going to have a lot more acne. They're going to have male pattern baldness. So then I'm attacking their testosterone. And it's mainly the dihydrotestosterone, the bad testosterone that's really high in those patients. And I usually go for that. And I use a lot of saw palmetto in those patients. Berberine's great for those kind of patients too. Inositol is another great one for those patients. And then, birth control patients. Those are always really interesting. I tell them the first appointment, like, how do you feel about getting off of your birth control? And they always seem kind of shocked and like, I don't know. I had such bad periods and I can't get off of it. And I'm like, don't worry. Like, let's try it out. And I teach them how to get off their birth control across the board. You have this 21-year-old female. She's on birth control. Her estrogen is so low that she looks like she's going through menopause. Her bad estrogen, called estrone, will be high. That's the stuff that causes that midsection weight, fibrocystic breast. And then progesterone will be tanked out. Testosterone will be lower. Those patients on birth control is like, I have no libido, or I'm really run down and tired. All your hormones are tanked out, because what happened is the brain doesn't know the difference between real estrogen and progesterone and fake estrogen and progesterone. So when you take that pill, your brain senses, I have enough estrogen and progesterone. I don't need to tell the ovaries to make any more. Wow. And so your ovaries kind of stop producing. 85% of your testosterone is coming from your ovaries, and you need testosterone as a female, and that gets shut down too. And now you're on this birth control, and all your hormones are kind of out of whack, and I get them off of their birth control. And then I slowly correct their hormones, whether it's with some progesterone, testosterone, whatever the case may be. And our menopausal females. So those are the ones that are feeling run down, tired, thinning hair, weight changes, skin changes, painful intercourse, so many drastic changes. Those patients, again, we check the labs, we screen those patients very thoroughly, whatever breast imaging they feel comfortable with. I'm usually ordering more of like a thermography, but whatever kind of breast imaging, family history, making sure that, their blood's not thick, all those things that we screen them out for, and their personal history, obviously. And then we talk about hormone replacement. And typically, if you're somebody who's never been on hormone replacement, I'm going slow and low. We're trying some light little hormones, seeing how you're doing. We meet often enough that we can adjust as we go. We get labs along the way. It's always going to look like initially in the beginning for a lot of those patients who've never been on hormone replacement will be one cream and a pill is usually how I start. Every patient's a little bit different, but I would say, that's how I start. The dosing or the concentration will be different based on the patient. And then some patients, they're like, you know what? I tried the cream, I tried the pill. It's just like, I don't like the cream. Then we talk about pellets.
Okay. And is that considered bioidentical?
Yes.
The term. Okay. So what does that mean?
Yeah. So that means basically it's made in a compounding pharmacy for your body. Okay. And the structure of what is being made is the same structure as your estrogen or your progesterone. So we can actually test it in the labs and see that, okay, your body is responding well. You're going to get rid of all of like the filler and like the chemicals that they put in like my hormones. You can't just go to CVS and pick up my hormones. It's going to come from a compounding pharmacy based on your labs for your body. Okay. Not everybody is the same. And I know a lot of patients get really nervous about hormone replacement and they've heard a lot of negative things. And I always remind them, when you were 20, your estrogen was 300 and now you're less than 15. The lab can't even read it. And I'm not trying to make you 300. I'm just getting you enough that you're not having the side effects. And it does play a huge role in longevity, hormone replacement. I mean, so important for heart health, so important for your bones, your memory. I mean, people get dementia, right? After their hormones tank out, you start getting osteoporosis after your hormones tank out, heart disease after your hormones tank out. So it's really preventative as well.
Wow. That's interesting. I didn't know that. Do you feel like maybe sometimes it gets a bad rap?
Yeah.
Yeah. Okay. So 100%. Why are people dogging that?
Because it was put out there, that hormones cause cancer.
Yes.
And then, my question is, well, why doesn't all of our 20-year-olds walk around with breast cancer?
Yeah. Because we were on birth control, right?
Not so that was that, but when you're so young, your hormones are through the roof. Your estrogen is through the roof. And so, that's one argument you can make. And hormones are not for everybody. Not every patient that walks into my office am I lathering them up in estrogen and things like that, right? You really do have to screen the patient. Now, if you're a high risk patient, meaning you have a strong family history of cancer or a female cancer, breast cancer, we have to have that conversation. How bad are your symptoms and, how is your day to day and what kind of screening are we going to do for you? That's going to be separate from a patient who has no family history of breast cancer and feeling great. And, they're a perfect candidate for hormones. So everybody's different. And there's a lot of patients who don't feel comfortable. And then we use a lot of homeopathy on them. We're using a lot of the tinctures and glandulars and supplements to help them with their symptoms. But I definitely love hormone replacement. I will probably be on some sort of hormones forever. Yeah. And it really is a game changer. If tested, screened, and treated correctly, it really can help patients and live a good, happy, healthy life.
Yeah. So don't be so scared of it.
Don't be scared, but ask questions.
Ask questions.
Always ask questions. If you don't feel comfortable, I always tell my patients, if you don't feel comfortable, I don't feel comfortable, and we both have to be on the same page. And I'm always going to support your decision. I'm always going to support what you feel right is for your body. Because at the end of the day, I may be the doctor and I might have the knowledge, but your body so much better than I do.
Yeah. Yeah, that's a good message. I like that. Can we talk about parasites?
That's another one. It's all over Instagram and TikTok, and it is everywhere. Parasites. I think everybody has them, right? But not everybody is symptomatic with them. Everybody has, I think, some level of parasites, but not everybody is having the itchy bottom and bloated gut and craving everything under the sun and the rashes and fatigue. What I keep seeing on social media almost makes me cringe because they're just doing it wrong. You really need to have some kind of guidance when you go through a parasite cleanse. Again, I know at the last episode we talked about your detox pathways. That is first and foremost. You've got to open up those detox pathways. You've got to work on your lymph. You've got to eat correctly because again, if you're taking all these supplements to kill parasites, but then you're eating all the sugar and the junk to feed them, it's like a vicious cycle, and your bowels have got to be moving.
Okay.
If you're killing these guys off and they're not coming out of your body, that is not a good situation either.
Yeah, that's not. So don't jump straight to a parasite cleanse.
Absolutely not.
And there's like people on Instagram, like, I don't know, selling cleanses and, you know, like.
I think the one it was like para cleanse or something like that. I don't know what it was, but it was like, everybody's like, oh, I just add this to my water and oh my gosh, the things that I release. And like, I don't know how much of that is true per the people who are saying that out there, but it's not good. You're probably not going to get them all out, and you might be doing a little bit of like harm than helping yourself. So I usually recommend like a month or two of just working on your detox pathways, eating clean, saunas, everything you can to really get things moving along. And then, that month 2, 3 is when you start jumping into the actual parasite cleanse.
Okay.
I really like Cellcore a lot. I've used that a lot for a long time in a lot of patients, and it seems to be really well tolerated. They have like the different phases that walks you right through it. And so I find it really simple, easy for my patients to do Cellcore. And little thing that not a lot of people know about is really you should do the parasite cleanse around a full moon.
Oh, yeah, I've heard this.
It sounds like so hocus pocus, but it's true.
No, those critters are like out to play, right? Like during the full moon.
Yeah.
I'm intrigued by this.
Yes. And the reason behind it is because of how bright it is, the full moon, and the more like light you get, the more serotonin, and it's very activating for the parasites. So that's actually why it's around the full moon that you should do your parasite cleanse.
Oh my gosh.
Fun fact.
Fun fact. And I've also heard like if you typically don't sleep well on a full moon, right? That could be parasites.
Yeah. Or that itchy bottom. Nobody wants to bring up the itchy bottom, but you know who you are.
If you have an itchy bottom, you may have a problem.
Call me.
I call you. The Cellcore, like what does that consist of? Is it herbs? Is it tinctures?
It's a lot of herbs. They do have a tincture. Okay. It's a lot of herbs, pills during like the first month or 2 months of opening up your detox pathways. It's a lot of working on your mitochondria, your liver, adding in minerals and getting your bowels to move. And then that second month is when your poop gets a little funny looking, and that's really where you're adding in a lot of like the strong herbs to kill off parasites, the mimosa puticas, and that's like gets really like gooey and sticky in your gut and kind of pulls it's like almost like a binder for parasites. It's like pulling, it's like sticking on the lining of your gut and pulling all that out.
Wow.
So, I've gotten some really cool pictures.
Oh my God.
Probably everybody else is like cringing, but I don't know. My patients love to show me
they
pictures
like
of
to share.
Yeah.
And like actual, like for those that don't know and don't really understand that, like worms will be, you can see worm carcasses like in your poop, right?
I've like long
worms.
Like I've like covered in poo. Like patients have sent me pictures. I've had patients like it's come out of their sinuses before when they were doing like nasal rinses, like just stuff.
That is, there's a video circulating on Instagram where like someone pulls out with a tweezer, like a long worm. And I get so grossed out.
Guys, it's not that bad. It's not like that.
Dr. Gandhi is not going to pull a worm from your nose if you go see her.
It was more like a long like goop, I guess you could say. It was like a long goop that you have to work a little hard to break apart.
Oh my gosh. So do you think like is a parasite cleanse something that everyone should do, or are there people that should avoid it? Like,
I wouldn't say that people need to avoid parasite cleanses. Do I think everybody should do one? That's a great question. No, I don't think everybody should do a parasite cleanse. I think it's worthwhile to get tested or, at least evaluate patient symptoms. So if there's a patient who has like lots of heavy metals and candida and they're doing everything right, but we can't get rid of it, that patient, I might not even test them and I might put them through a parasite cleanse because that parasite is going to hold on to the heavy metals and candida and just store it in your body. So until you get rid of the parasites, will everything else kind of move along?
Yeah.
But I do think it's worthwhile testing just because the parasite cleanse can be 4 months long, and like, who's, not everybody wants to commit to like 4 months of doing this. And I'm a big believer in like, I don't want to over supplement my patients. Like it's already a lot. You're eating clean, you're grounding, you're sauning, like you don't need to take like 30 supplements. So my whole thing is like, let's test you, let's treat if needed and move on. Like you shouldn't be on like a million supplements for the rest of your life. And it's more work on your body. Like your body still has to break these things down and get them out. And I don't think everybody needs to go through a parasite cleanse. I do think that everybody has some parasites, but not everybody is symptomatic.
So some degree of parasites in your body is normal, and we just like live that way, and like we're okay. We live as one with the parasites.
Again, you're probably going to feel it if it gets really bad. You're going to start having symptoms, and we're initially going to say, okay, it's like for the patients who are not ready to do the stool test, we're going to say, okay, you have a lot of candida, you have a lot of heavy metals, like, or those patients. Okay, fine. If you're eating a lot of sushi and like you're getting your steak like medium rare, like if your steak is walking off your table, yes, do a parasite cleanse.
Yeah, the sushi is huge because that is parasite central.
Yeah, our bodies were not made to eat raw meat. Okay. And then majority of my patients, because I ask everybody, we dive into all the things, and I say how often are you pooping? Yeah. And if you're only pooping maybe once a day or once every other day, now you got raw meat sitting in a very warm environment for a long time. It is rotting away in your gut, and the parasites are thriving on that. They love that. That is like their food. That's their environment.
Oh, so they're like, yes.
Yeah. So
I'm giving my parasites in my head they're like little characters. That's what I keep thinking.
Yeah, I mean, they're definitely there. And if you're eating sushi, you probably have parasites.
Yeah. I was eating sushi and I stopped. Yeah. I don't eat it anymore.
When I first started practicing functional, so I grew up mainly vegetarian, and then I got vegan, and I went through all the phases. Now I eat meat for sure. But when I first started functional medicine, I think I was so grossed out with how much parasites and heavy metals. I completely cut out seafood, all seafood for, I would say, about 2.5 years. I just recently will every once in a while eat some fish.
Wow.
It's not very common.
Yeah. Interesting. I eat a lot less fish too. I mean, since seeing you, I think, and it's funny, people are like, oh, I can never stop eating sushi. Oh, I can never stop eating this. I can never stop eating that. But it's I think once you cut it out, sometimes you're like, oh, this doesn't make that big of a difference to me.
I mean, those patients, I always say how bad do you feel and how good do you want to feel? Yeah. And that kind of is the patients who feel terrible, they're telling me that they're terrible, but I can't give up sugar. I can't give up gluten. And then it's just well, you have to decide, what is doable for you. And I'm going to support whatever your decision is, but what you're doing isn't working. So let's just try something different for a little bit of time.
Try something new.
Yeah.
Yeah. I think that's a theme of these episodes is, if you're feeling bad and what you're doing is not working, figure something else out, try something else. Try something new. I love that. Okay. So I want to know your top 5, over and above everything, your top 5 wellness tips. Maybe it's something we should take. It's something we should do. Give me the good stuff.
Oh, I only get 5. You only get 5.
I know. I'm trying. I mean, I feel like 5 is a lot, but
I think it's so important every day to pick yourself. I think if you don't pick yourself and you don't make yourself a priority, nobody else is going to go on the walk for you. Nobody else is going to take your vitamins for you. I think that that's going to be number 1 for me. That you wake up and pick yourself, have the intention for the day and take care of yourself. Number 2, sunlight or outdoors, nature. I know it's snowing in some places right now. You can't get sunlight, but just get outside, whether it's 10, 15 minutes. I love grounding. I'm really big on that. At least 3-4 times a week. I think it's really important just to be one with nature. a lot of diseases are a lot less in some of the third world countries as far as like autoimmune because of they're wearing cloth and they're walking around barefoot.
So interesting.
And so they're releasing the energy. It's actually called the Lululemon pandemic.
Wow.
And it's all that like friction from the clothes, and then you're wearing rubber shoes and you're like holding in all the energy. So like in India, for example, everybody's wearing their saris, they're like cloth saris and barefoot, and you're releasing that. So that's really what grounding is releasing that. So I do love a little grounding if you can, if you're not in freezing cold weather. I think that's really important to get
Explain what that is, grounding to people that maybe don't know.
Yeah. So it's basically you're barefoot. 15, 20 minutes is all you need every day. And you don't have to, but I do recommend just doing it without your sunglasses on and just being outside, and you just release a lot of that like energy that's cooped up in your body. It's so good for your adrenals, which helps you with like your stress and anxiety and fight and flight. And it's just calming. It's calming to your body. It gives you, you get a little bit of vitamin D, not that it's enough, but you get a little vitamin D and it's really, really good for your mental health. So I usually recommend 15, 20 minutes outdoor grounding for my patients that are in places that they can do that. But just getting out in nature, I think would probably be number 2. Number 3, I feel like I'm like shoving a lot into each number.
No, we love it. We love it. Give us all the good stuff.
I'll go back to my basic 5. I talk about pill fatigue a lot with my patients because some of my patients are going through detoxing and they are on a good amount of supplements. And I just say that morning when you're just like, I can't today, at least take your basic 5. Multi because our soil is not that great. Vitamin D because we all shower, we wash off the healthy oils. So trying to get out in the sun just might not do the trick because we're missing the oils, we're wearing sunblock, we're wearing clothes, so we're not getting that vitamin D anymore. So I always incorporate a vitamin D. Your fish oil is so important for your cell communication, your energy production in your body, your B complex, again, energy and metabolism, hormones. B's are so important. Okay. And then your probiotics, having healthy bacteria back in your gut. A lot of the foods that we're eating, they just have pesticides and chemicals that's destroying our gut, and the lotions and shampoos and all those things go in your body and they disrupt the healthy bacteria in your gut. So just a good probiotic. What number am I on? I think that was number 3. Sleep is huge. I personally have struggled with sleep a lot, and I have the gadgets and stuff, but sleep I think is really, really important for just healthy lifestyle, well-being. And then the last one will have to be gut health, like just every day, just doing the best you can. Yeah. When you can make a good decision for your gut and your health, just do that, and I'm not saying that I'm perfect. Like I like to get my hair dyed, it's terrible for you. Yeah. It's so bad for you. But, I'm eating, the cleanest I can. I'm, working out, I'm taking my supplements. So make good decisions when you can, and don't fault yourself. Be kind to your mind.
I love that. Those are all things that everyone can do. It seems very manageable. Like start there, right? That's a great starting point for people.
It is. It really is. And just try it out 1 week at a time. And at the end of the week, if you feel better, try it out for another week. Accomplish the month, write about it. And anytime I always write when I feel really good, because I can reflect back on the times that I fall off the wagon too. And I can look back and gosh, when I felt good, I was taking my methylene blue. I was walking outside every day. I was going to the sauna. I was sleeping good, all those things. And it's I know the formula that works.
Yes.
I just got to do it again.
I got to do it again.
Yeah.
I know. Exciting news. Yeah. I got a sauna for my house.
Yay. That's awesome.
And I'm it's actually being hooked up today, and I couldn't be more excited about it.
Yeah, that's awesome.
Yeah, because that was something that really, really helped me. And I love to sweat, and I love, I haven't gotten to the point where I can do the cold plunge and the sauna and alternate, but the sauna is it's relaxing to me. I feel really good. My skin feels really good. I love that good sweat. Oh gosh, that's so addicting, know?
Yeah.
How many days a week would you say? I mean, even if you just get there once, right? To the sauna.
Anything you can is better than nothing.
Yeah.
2 to 3 times a week is usually what I recommend my patients. Okay. 20, 30 minutes if they can tolerate or work up to that.
Okay. That's good.
Yeah.
That's so good.
Yeah.
Dr. Gandhi, tell everyone, because I forgot to do this on the last episode. So I'm going to put it in the show notes on the last episode where to find you, but where can people find you? Tell us.
Yeah. So you can Google Kunal Gandhi, or you can look up GandhiHealthAndWellness.com. That is my clinic. The number is 561-247-3311, and I'll be happy to help you.
Oh, Dr. Gandhi, you're the best.
Thank you.
So thank you so much for sharing all this knowledge with us. Like, I know everyone is going to soak this all up, and I'm so excited about it for all of you to get on the right track. If you liked this episode, please review it, share it with someone you love, and we'll see you next time on The Cinnamon Effect.
Thank you.
Thank you.